Welcome. In previous lecture, we speak about the back pain, its causes and methods of relief, and why we try to speak about back pain. It's important to note that back pain can have various causes, and the paramedical evaluation is necessary to determine the underlying sources and recommend appropriate treatment. Epidemiology: the prevalence of back pain in the adult population varies with age. There are numbers of surveys in point prevalence of about 17 to 30%, a 1-month prevalence of 19 to 43, and a lifetime prevalence of 60 to 80. Epidemiology: back pain is a major global health concern affecting millions of people worldwide. There are breakdown of its prevalence, impact, and risk factor. Globally in 2020, an estimated 619 million people experienced back pain, making it the leading cause of disability. This number is projected to rise to 843 million by 2050 due to population aging and growth. Age and gender: back pain can occur at any age, but its prevalence increases with age. The peak occurs between 50 and 55 years old, and the highest disability impact is seen in people ages to 80 to 85. Gender: women generally report experiencing back pain more frequently than men. Disability: back pain is a leading cause of disability, causing activity limitation and hindering work participation. It's estimated to be responsible for 34.9 million disability adjusted life year globally, making it the 6th leading cause of deaths. Economic burden: back pain imposes a significant economic burden on individual, families, and the healthcare system due to lost productivity, medical costs, and disability payment. The risk factor: age. As mentioned earlier, the risk of back pain increases with age. Genetic: some individuals may have a genetic predisposing to back pain. Occupation: jobs involve heavy lifting, prolonged sitting, or awkward posture increase the risk of back pain. Lifestyle factor: obesity, smoking, lack of physical activity, poor posture are all associated with increased risk of back pain. Mental health conditions like stress, anxiety, depression can also contribute to the back pain. The likelihood that an individual will recall on survey that they have experiencing back pain in their lifetime reach 80% by the age of 60 years, and there is some evidence that the remaining 20% have simply forgotten prior episode of back pain or consider such episode as natural part of life and worth reporting. At the age of 40 years, this prevalence is slightly higher in women, while after the age of 50 it's slightly higher in men. The majority of these episodes of back pain are mild and short-lived and have very little impact on their daily life. Recurrences are common, and one survey found that up to 14% of adult population had episodes of back pain each year that last 30 days or longer, and at some point interfered with sleep, routine activities, or work. Approximately 1% of the population is permanently disabled by back pain at any given point, with another 1 to 2% temporarily disabled from their normal occupation. Children and adolescents are not immune from back pain. Surveys reveal that approximately 5% of all children have a history of back pain that interfere with activity, with 27 reporting back pain at some time. Here the prevalence of age, this is the age per years, this is prevalence. The prevalence rate for low back pain in the general population by age. The lifetime prevalence represents the part of symptoms having occurred at any time prior to the date of inquiry or survey. The 1 year prevalence represents the likelihood that a person will report an episode of pain in the year before an inquiry. Pointed prevalence is the likelihood on survey of person reporting pain at the time of inquiry, adapted from reference 1 to 3 with permission. Work-related back pain. Back injuries make up 1/3 of all work-related injuries, or almost 1 million claims. 150 million work days are lost each year, affecting 70% of all American workers. Half of the lost work days are taken by 50% of this population, usually with prolonged period of time loss, while the other 50% of lost work days are for a period of less than 1 week. As we mentioned, the epidemiology of this associated with age. It's globally. It's related to age and gender. Women more affected. Age group from 50 to 55 more affected. There is this impact on the population, the disability, causing affecting activity limitation, hindering work participation, days lost, economic burden, healthcare system lose productivity, there is medical cost, there is disability payment, risk factor, the age, genetics, lifestyle factor, mental health, children not immune from this back pain, and there is lost days for this condition, back pain or low back pain, time loss, and also payment for medication for disability. Thank you.